to Channel 101 News. My name is Al.
Hi, and I'm Nydia, and we'll be introducing the topic of the Ebola epidemic going on recently in Africa.
Right now, we'll be starting with the history of the Ebola virus with Nydia.
Hello once again, and I'll start off by saying the origins of the virus began in 1976, found near the Ebola River, which is why the virus is named after the river. The first outbreak infected over 284 people. The mortality rate at this time was 53%. Just a few months after that, the mortality rate went up to 88%, infecting 318 people. This epidemic has been breaking out every 20 years after they had dealt with it before. Ebola is a disease caused by one of 5 different Ebola viruses. 4 of the strains can cause severe illness in humans and even animals. The 5th, Reston virus, has caused illness in some animals, but not in humans. Ebola is extremely infectious, but not extremely contagious. It is infectious because a small amount can cause illness. Even a single virus may be enough to trigger a fatal infection. Humans can be affected by other humans if they come into contact with bodily fluids from an infected person or contaminated objects from the infection. Clearly, this epidemic is serious. Now back to Al.
Thanks, Nydia. The Ebola outbreak has been something that has been known for different cases and outbreaks. Starting off from where the place it all started, Zaire has had 208 reported known cases of Ebola, and 88% of the population, or 246 people, have died from this disease. Let's talk about the death rates of the 5 Ebola virus species. First of all, to start off with, the greatest of them all is 79%, none other than Zaire. Second would be Sudan with 53%. Third would be 27% from budding Bugyo. Fourth and fifth, which would be Reston and Thai Forest, but they both have a 0%. There are other diseases that just don't even compare to Ebola. For one thing, the disease can't be transmitted through the air, or it's not an airborne disease, such as measles or influenza. Comparing Ebola to other diseases' death rates, Ebola has a 60 to 90%, bubonic plague with a 66%, smallpox 30%, meningitis 10%, and flu with only a 0.1%. Secondly, there are other places like South Sudan, Uganda, South Africa, Gabon, and the Democratic Republic of Congo with diseases of Ebola, but they don't compare to places like Zaire, considering the percentages are lower than 88%. For example, in places like Africa or Zaire, you can prevent Ebola by using infection control measures such as complete sterilization of equipment, isolating people with Ebola from the infection with unprotected people, and wear protective clothing such as masks, gloves, gowns, and goggles. As you can see, there's many different ways to prevent Ebola, but it always starts with you and your home and your family. Now back to Holly.
Thank you, Al. That's what he calls me on work days. Anyways, we'll transition to Chris, the weatherman.
If you want to travel to Africa at this moment, you should take some precautions before going there. First of all, you should check for CDCs at the area you want to visit before going there. Practice perfect hygiene and avoid contact with blood and body fluids. Mainly avoid areas where there's suspected Ebola cases. This year, there has been 1,134 cases and 622 deaths, all in Nigeria. To those of the airport personnel, try to be on the watch for any illnesses at the airport. Now back to Al.
Now, we may know about the specifics and details of Ebola, but let's head back to the basics. Madalynn?
Signs and symptoms include fever, headache, joint and muscle aches, weakness, diarrhea, vomiting, stomach pain, lack of appetite. Some symptoms are rash, red eyes, cough, sore throat, chest pain, difficulty breathing, difficulty swallowing, internal and external bleeding, and hiccups. See, next is what I'm going to talk about is exposure. Exposure can last between 2 to 21 days, but common is 8 to 10 days. Avoid direct contact with blood and people that are infected. Please do not expose yourself to any needles or objects that are within the patient that has Ebola. And as far as treatment, balance fluids and electrolytes, maintain oxygen, and your blood pressure, and treating any patients with a conflicting infection. As far as handling prevention, wear protective clothing, use infection control measures, isolate yourself from patients, recognize cases, and prevent any future transmissions in settings. And don't worry about your pets. It only affects primates and humans.
Thanks, Madalynn.
Alright, thank you guys for joining us for another great afternoon on Channel 101 News.
And remember, stay sterile, folks.